Oops.
Good morning, good afternoon. My name is Jill Stott. We will get started in just a few minutes. While you're waiting, just to let you know you are muted and your video is turned off. But while we are waiting, if you wouldn't mind to add your name and where you're joining us from in the chat, we would love to hear from you. Okay, it looks like and I see that some folks know what we've been doing in the past. So if you are joining with a group in your room, please add their name and email to make sure that we get their certificates to them. But I think it's safe to go ahead and get started. It looks like folks popping on have slowed down. So again, good morning, good afternoon, depending on where you're joining from. Today, my name is Jill Stott. I am the Northeast Coordinator for Tennessee Commission on Children and Youth. And I'm also joined with my counterparts across the east side of Tennessee, Christy Paling, Lindsay Cody, and Marissa Player Montgomery. We are thrilled to be able to have collaborated with Mental Health Association of East Tennessee to bring you the February series of the Mental Health Lunch and Learns. Just a few housekeeping items. Again, if you will continue to put your name and where you're joining from in the chat, as well as if you're joining with a group of folks, please add their names and emails. You are muted and your video is turned off. And we are recording. So also, if you joined us for last week's training on typical or troubled, Tennessee Commission on Children and Youth, we were in Nashville last week for our commission meeting and we're off yesterday. So there is a little bit of delay in getting our most recent certificates and information out to you. So just bear with us and we'll get those out to you as soon as possible. You will be receiving for attending today, you will be receiving a link to the recording today, as well as your certificate and a PDF to the presentation. So we'll get started and let me introduce you to our two presenters, Caitlin Inslee and Janae Cummings. Janae currently serves as the screening program director at Mental Health Association of East Tennessee. She completed her Master of Public Health with a community health education concentration and a health policy graduate certificate at the University of Tennessee, Knoxville. Prior to moving to Knoxville for grad school, she completed her Bachelor of Science in Exercise Science and Secondary Education at Lee University in Cleveland, Tennessee. Janae is passionate about workplace culture. Oh, I'm getting a little ahead of for next week. So in addition to monitoring and analyzing mental health screenings data across East Tennessee, Janae is passionate about workplace culture, health equity and inclusivity, mental health, and overall wellness with an emphasis on marginalized populations. Caitlin Inslee is the Senior Director of Education and Outreach at the Mental Health Association of East Tennessee. With degrees in social work from the University of Tennessee, Caitlin has firsthand knowledge in navigating the mental health system and years of experience helping youth, parents, and professionals understand its complexities. So welcome, Caitlin and Janae. Thank you so much.
Good afternoon for our folks in Eastern time zone, and good morning for our folks joining from Central. This is navigating the mental health system. Like Jill said, my name is Caitlin Inslee, and co-presenting today is Janae Cummings. We'll be doing some back and forth, but between us, we have over 10 years of professional experience in the mental health space and even more addressing our own mental health needs. And we'll share some of our own experience as we discuss this topic. So next is a brief agenda of the topics that we'll be covering for today's training. For treatment, we're specifically going to be focusing in on outpatient treatment. We'll be spending some time discussing medication and finally touching on hospitalization and crisis services. Today's objectives are to differentiate between different types of mental health treatment and professionals, explain the steps required to get a therapy appointment, and describe confidentiality and specifically how it affects children and their caregivers. So I'll go ahead and let Janae take us away.
Hi, everyone. Good morning, good afternoon. So why should we get care? That's like the big question. Why should someone get care? Why should my child get care? Why should I recommend someone to get care? The big why, especially with the stigma that surrounds mental health, a lot of us are like, well, why should I go to therapy? Why should I get help? So hopefully throughout this presentation, we're able to answer some questions and help you guys navigate pursuing help or helping people in your life also get the help that they need. So why therapy? People don't usually grow out of their mental health problems. And a lot of our mental health issues start from when we're younger. And if you don't tackle those issues early on, over time, they tend to get worse or they get stagnant. It's harder to cope when you wait longer to receive the help that you need. So that's why it's important to, the minute you notice that you're struggling with something, start pursuing that help. Or if you're unsure if you need the help, still pursue that help anyway. There's no right or wrong time. There's no too early, but there could be a too late. But also you don't need a big dramatic or traumatic thing to happen to you in order to pursue therapy. Your life could seem perfectly normal, but it will still be helpful to pursue some help to process some feelings or things that you might be going through. When you're struggling, you can miss out on a lot of your life. As kids, if you're dealing with children, if your kids are experiencing a lot of traumatic events or just a hard time in their lives, their family lives aren't the most ideal, they can be missing out on just having a childhood or a healthy childhood, or even as adults, you can be missing out on focusing on your career, focusing on your family if you don't get the mental health help that you need. And early treatment works better. So like I mentioned before, the earlier you start working on your mental health, the better. So what are your options for treatment? There are a variety of options. There's inpatient, outpatient, and some others. And in the next slide, I'll go through a few of them. The one that we're most familiar with is probably outpatient, but in the next slide, you'll see that there are a variety of things that you can do to pursue mental health help. So types of treatment, inpatient treatment, that includes hospitalization. Hospitalization is the most intense level of mental health help. Usually you're in a space for a few days. You're not allowed to leave. People are in there watching you, taking care of you. It's a commitment. And you're typically not allowed to leave until you're showing some type of progress. And then once you leave, you're still being heavily monitored, just to make sure that you are working toward improving your mental health. Then there's residential treatment. This is a little bit less severe than hospitalization, and it often includes long-term care. So you're in there, you live there, hence why it's residential, but you're there for an extended period of time. You probably don't get to leave immediately, and you're under consistent supervision in residential treatment. And then partial hospitalization, again, a little bit less intense than hospitalization and residential treatment. But the idea is the same. You're in there for a chunk of time. They're monitoring you to make sure you're okay before they release you. So outpatient treatment, like I mentioned before, is probably the one that we're most familiar with, where you're going to meet with someone regularly, it's usually one-on-one, and you're talking to them about whatever it is, and they're helping you work through your mental health crisis. And the other treatment options, there's support groups, a lot of religious organizations, a lot of college campuses, a lot of rehab facilities and things like that offer support groups where you're in a room with other people that are sharing some of the same experiences as you, and you kind of just sit there and you talk through and process what you're going through. Then there's peer support. That can vary and look different depending on where you're getting your peer support from. You might say peer support to someone and they think a friend or a colleague or someone who's in your immediate circle, or they can think of peer support as someone you're talking to outside of your therapist or your regular care. So like for us, we have a peer recovery call center where you're talking to other peers who have experienced some type of mental health crisis or substance use issues, and you're working with them. And then there are treatment for treatment resistance disorders. So these come into play when regular treatment, such as inpatient and outpatient, isn't working as well. So hence why it's treatment resistant. So these are some other options, which include TMS, NECT, and some other things. And then we have medications. A lot of inpatient and outpatient treatment is paired with medication. It's not bad to be on medication. Medication is helpful. That's something else that is very much so stigmatized in pursuing mental health help, but that is another option as well. So how do you decide what you need? You want to look at how severe is your mental health crisis or journey or endeavor. Are you at the place where you're considering suicide? Are you at the beginning of things might be stressing you out a little bit, or are you in the middle of some days are bad, some days are not? So something we like to reference to is like a pool. So where are you at in the pool? Are you on the shallow end? Are you in the middle? Are you in the deep end? If you're in the deep end, you might want to get help immediately. But if you're in like the shallow end, you can probably survive a little bit or maybe make it most days without some help. You also want to look at cost because therapy is not cheap. It does cost money. So you want to look at insurance and what does your insurance cover? So some insurances include mental health treatment, some don't. I think as time is progressing, a lot of insurances are adapting to including mental health services in their plans, but it's still not a guaranteed. How much would each of your sessions be? Is another thing to consider. And how many sessions do you need? Do you need to be seeing someone multiple times a week, once a week, every 2 weeks, once a month, or as needed? Normally what happens is when you first enter treatment, you might start off once a week, depending on where you're at. Then as your mental health improves or as you gauge what you're getting out of your sessions, you might decrease to every 2 weeks and then to once a month. So for me personally, I am in therapy and I see my therapist bi-weekly. And she tried to draw me down to as needed, but I told her no. But it just depends on what you need. Like, are you in a place so you can see them bi-weekly? Are you in a place where you need to see them more often? But the idea is to kind of phase out of therapy to where you're able to handle your mental health on your own. Some of us never get to that place, and that's okay if you consistently need to see someone in your life, or if you reach an as needed basis, that's good as well. And also availability. As we know, there is a shortage in mental health care, especially here in East Tennessee. So you want to make sure that who you're wanting to see is accepting new clients on top of like your insurance as well. Because if they're not, then you might be waiting months at a time before you can get seen. I know like on college campuses, the wait time is months. You're probably going to wait a whole semester before you can get in the door. So you want to make sure that who you're wanting to see is able to accept you as soon as you're wanting to be seen. Because if you're in the deep end of your pool, you don't want to wait 2 months before you see someone. But if you're more of like you're shallow and you can manage for a few weeks, then you might be okay with waiting. So that is something you need to consider when you're wanting to pursue outpatient treatment. So where do you start? So if it's an emergency, you need to start immediately. Immediately, as in like yesterday. If you're at risk for harming yourself and others, you need to call the mobile crisis lines. At the end of this, we have some resources for you. Visit your local ER or just walk in somewhere, but don't suffer by yourself if you know that you are at risk of ending your life, or if someone you know is also at risk, you want to go with them or be with them and make sure that they're getting into the doors as soon as they can. Check with your primary doctor or pediatrician. So sometimes your doctors might know of some clinicians in your area that can help you or that are accepting new clients or that accept your insurance. So I know for me, my doctor knew of someone who was able to get me in the doors immediately, and I didn't have to look very far as pursuing therapy with someone else. It might take a little bit longer. If you're younger, or if you're working with youth, they can see their school counselors, social worker, or school-based therapist. You can also check your insurance's database. So if you have, I don't know, Blue Cross, Blue Shield, or Ambetter, normally you can go into your database and type in like what you're looking for within your area, and it'll pull up a list of providers that are available to you. And also just do your own research, especially with telehealth being an option these days, so you don't have to be, what's the word? You're not locked into your jurisdiction. You're able to look beyond that. So do your research, talk to other people. It's likely that someone you know is probably also in therapy. Ask them how they went about getting their therapist, or if they have any recommendations, or if you have a trusted teacher or professor or someone that sort, a mentor, ask them, because chances are they might have resources that they can point you to.
So, outpatient therapy, outpatient treatment is where most folks enter or start having interactions with a mental health treatment system. If you are not in a crisis, or you either have insurance, whether that be in TennCare or private pay, something through the marketplace, or something through your employer, or let's say you can't afford the out-of-pocket care, the hourly rate, it still is generally going to be the most affordable and consistently available form of mental health treatment. Outpatient treatment is outpatient therapy. It's known by many names, including psychotherapy, mental health treatment, talk therapy, or they just simply call it therapy. All are correct. Therapy can be an absolutely effective form of treatment for those who are experiencing a broad range of mental health conditions and or emotional difficulties. This can include things like relationship problems, if you're having job stressors, if you're experiencing grief. The goal of therapy will it will vary person by person. But in general, it is used to help eliminate or control troubling emotions or patterns of behavior so that someone can function better and increase their overall well-being and healing. Even if someone doesn't believe their problems are quote unquote bad enough to get use out of therapy, like Shawnee was saying earlier, anyone can benefit from accessing services from a licensed professional. Some other things that can be addressed through therapy include trauma, the impact of a medical condition or diagnosis. That's a really big thing. If you've just gotten diagnosed with cancer, heart disease, diabetes, a lot of those will co-occur with mental health conditions. It's kind of a chicken egg situation. They intertwine. So addressing those mental health needs can actually improve the physical health components. But other things that can be addressed include managing stress or addressing specific troubling behaviors or thoughts, including non-suicidal self-injury, most commonly known as self-harm, like cutting, or if you're experiencing suicidal thoughts or behaviors. The one caveat with that is if you are experiencing if you're actively suicidal, you don't really want to wait around for a therapy appointment. It's kind of like you need to get help in sooner. Therapy can also be really beneficial when someone is going through a period of transition For example, couples may find it really helpful to go to couples counseling, even if they're not having any existing issues in their relationships. Or expecting parents may go into therapy but when they're expecting a child because they know their life is going to change. Or someone might automatically get hooked into a therapist when they're starting a new job, because it can be helpful to have someone you can go to help manage those just transitions in your life.
So how do you pick your therapist? Finding a therapist is like shopping. You want what works, you want what fits, you want what feels good. You don't just want to walk into anyone and deal with anything. You want to make sure that the person you're seeing is someone who's a good fit for you. So you want to look at what are you dealing with? Like, do you think you're dealing with anxiety, depression, PTSD, psychosis, depending on your assumed or self-diagnosis or what you think you might be struggling with, that might play a part in who you're pursuing to help you. Because some therapists specialize in certain mental illnesses. So in that process, you want to make sure that whoever you're seeing can help you with your specific diagnosis. There are also therapists that focus on trauma. So if you're dealing with lots of trauma, you want to make sure that your therapist can help you process that trauma. Or family relationships. And this is where um, family therapy or couples therapy, things of that nature. You're dealing with issues that are affecting your entire household. So what type of therapy do you want? And a few slides later, we'll go through what each of these look like. But are you needing cognitive behavior therapy? Are you needing that is a hard word. Dialectical behavior therapy, talk therapy, or EMDR. Like I said, I'll go into these a little bit later. But you want to make sure that your therapist is catering to the type of therapy that you might need. And some other factors to consider: gender, age, race, ethnicity, religion, language, sexual orientation, and cultural background. So I know for me, when I was looking for my therapist, I would have preferred that it be a Black woman because I'm a Black woman, and being a Black woman is an entirely different experience than a white woman or a white man or even a Black man. So I know for me, a non-negotiable was I wanted her to be Black and I wanted it to be a woman. If you're super deep into your religion, then you might want someone who shares those same beliefs as you, because the way you process your problems or your trauma or your grief is going to look very different depending on what your belief system is. And obviously language, you want someone who can understand you and who you can understand. Sexual orientation as well. There are therapists that specialize in LGBTQ plus communities. So you want to make sure that your therapist is a good fit for you depending on what you're looking for. And that kind of varies from person to person because another Black woman might be okay with having a white man as a therapist. Me personally, I don't want to sit there and talk about Black issues to a white man. So it kind of just depends on what you're looking for. And it's okay to be picky. It's okay to try out a therapist. You might go to one session and be like, you know what, this didn't really work for me, so I'm going to try someone else. So picking your therapist is really like shopping. If it's not a great fit, you can return them. And is it in person or telehealth is also a preference. Some therapists might offer some of both. I know mine, if I want to go sit in her office, I can, or if I just want to be on a Zoom call, I can do that as well. And once again, your insurance plays a big part in your access to treatment.
And just to piggyback off of Jeanne, you know, especially for our folks with TennCare, they may not have the luxury of picking their individual therapist, but they can still have decision making and choose which community mental health center they want to work with. And so they can do research on that. But there are a lot of different types of mental health professionals, which are listed on this slide. It's funny, as we were preparing for this presentation, I was like, I can talk on and on about all these different types of professionals and what they bring to the table. So if you have any more detailed questions about them, I am happy to answer them. Otherwise, I'm going to do a quick overview about what are these different types of professionals and the roles that they serve within the mental health treatment space. So to start with, I'm going to cover the professionals that are on the left side of the screen. So the ones on the left side all tend to be licensed in some way. So licensed social workers, also known as LCSWs or LMSWs, that stands for licensed clinical social worker or licensed master social worker. In mental health, you hear a lot of acronyms, so it can be helpful to talk them through. They've both received master's degrees in social work from an accredited program and have been supervised by another licensed social worker for a certain number of hours. This varies by state. But then they have to pass a licensing exam through the state. LPCs or licensed professional counselors, they'll also usually have a master's degree, often in counseling. Psychologists and psychiatrists will both have their doctorates. Psychologists usually have their training primarily in psychology and counseling. They can't prescribe medication unless they have that dual education, like in psychiatry, but psychiatrists are MDs. Their primary role is in prescribing. And even though some may provide talk therapy and some conversation is important as a part of the prescribing process, someone should be sitting down with you and talking about what you're experiencing to be able to point you in the right direction. That's not really their primary role. But finally, there are psychiatric mental health nurse practitioners or psych NPs. A lot of people abbreviate it to that. And they usually can prescribe and provide time-limited therapy. What type of professional someone sees really depends on their needs. For therapy alone, I personally recommend seeing someone who is either a social worker, LPC, or a psychologist. Something that's not on this list is an LMFT, which stands for a licensed marriage and family therapist. I recommend seeing someone who is licensed and their primary training is providing therapy. For medications, you can absolutely see a psychiatrist or a psych NP, but most medications can also be prescribed by a general doctor. And depending on where you go for care, if you're going to say see a mental health practice, some of them may have prescribers on staff, which is really nice. So you can go see your therapist and have an appointment with your prescriber on the same day and get those both knocked out. Same with their integrated healthcare settings where you go see your primary care doctor and they can send you down the hallway to see a therapist, and then you get your medication prescribed all in one go. Each type of professional on this list has received a different approach in their education, abides by differing codes of ethics, and has a differing accrediting body. Ultimately, it's based on personal preference on what type of professional someone sees. I think personally, it's more important that someone connect with their therapist on a more individual level versus necessarily picking one specific degree background. So looking at their needs before necessarily what the degree is. Continuing to the right, we have what will more than likely be unlicensed professionals. So there are peers. Peers are those who have lived experience with issues someone is dealing with. In Tennessee, someone can be certified to become a certified peer recovery specialist. And these people are able to use their own lived experience to help others going through a similar journey. There can absolutely be folks who are LCSWs and peer support specialists. It is possible to be licensed and also be in peer support. Peer support can be so helpful when someone doesn't have a robust support network or a support network you don't feel comfortable discussing your mental health with. And that's an important part of this as well. Many organizations, like Jonae was saying, we've got our peer recovery call center, and we're able to provide that support to folks who need it. And then we have support groups. These are things like AA, Alcoholics Anonymous, or NA, Narcotics Anonymous. They've got CR, Celebrate Recovery. There are a bunch of different support networks. Support groups. Support groups leaders and sponsors can also be a great part of your treatment team. And lastly, faith leaders who may or may not be licensed. Even though who are unlicensed may have some training in counseling, and faith leaders can be a really great first step for someone that is struggling with their mental health and has a really solid connection to their church or place of worship. However, it is worth noting there are licensed mental health professionals that have that background and also approach therapy from that faith perspective. So, for someone whose faith is important to them, it is possible to find someone who is licensed and meet you on that same level. Personally, I recommend choosing a licensed mental health professional as your primary form of mental health care. And this is the reason I recommend this is because they will have an accrediting body that they report to, which is an additional form of accountability if they were to behave in an unethical way. There may or may not be that same level of oversight for someone who's not licensed. With that being said, there are so many benefits to just bolstering up and throwing at your mental health whatever you can. So adding in peer support groups, faith leaders, adding in whoever you can to support your mental health journey.
Now we're going to look at the types of therapy, which I mentioned before that we will do. So we have CBT, which is cognitive behavior therapy. Is used to explore the relationship between your behavior and your thoughts and feelings, or both. So why am I acting this way? Why am I thinking this way? Why am I feeling this way? What is the relationship between all of these things? And then we have DBT. I'm not saying that word again. It focuses more on regulating your emotions and being mindful and accepting uncomfortable thoughts and feelings. So instead of looking at your behavior per se, your behavior in relationship to your thoughts and feelings, it's also looking at how do you regulate the feelings that you already have and how do you cope with them, how do you accept them. A lot of sessions, a lot of people probably use a combination of both of these things, and that's where you get talk therapy from. It's very rare that you'll separate the two because you kind of can't talk about your behavior without talking about how you're going to regulate that, or talk about your feelings without talking about how you're going to regulate that. It's just that they emphasize one over the other. So talk therapy is also known as psychotherapy, uses a variety of treatment techniques to help you identify your problems and your emotions and how do you change and cope with those. Then we have family therapy, which we've talked about already. Very obvious, is dealing with your family, whether that is you and your spouse, you and your children by themselves, whatever relationship, whatever you consider familial, is what you would use family therapy for. And usually this is done with all of you guys in the room together, or you can split it up between, like, I want my kids to have that time with the therapist and then like all of us together. It kind of just depends on the structure of your family. Now we have art therapy, which allows people to use their creative expression to process their feelings and their thoughts. So you can use art, dance, music, poetry. I would even consider like journaling a method of art therapy as well. It is very common for children and youth to use this method because, as we know, children aren't as good at vocalizing their feelings as they would probably like to. So instead of them sitting there being forced to talk about it, maybe they feel more comfortable writing about it or drawing about it. A lot of times you'll see in those sessions, they'll have like a piece of paper and they're like, draw what you're seeing, what you're feeling, or draw your family, or draw what's happening in your household. Or music. Music is a language that everyone understands. So that's what art therapy is. And then we have EMDR. I'm not as familiar with this. I think it's still kind of sort of pretty new, but it's eye movement sensitization and reprocessing. It's to help you process traumatic memory. So things that you might have repressed or that you've deflected from or that you avoided. This type of therapy allows you to bring all of that to the surface. And it involves your eye movement. I've never done it, so I cannot speak to what that looks like, but that is another type of therapy.
So before getting started in therapy, it's really important to understand the basics and what therapy is supposed to look like. So first, best practice for the length of sessions is usually going to be 45 minutes to an hour. Online platforms like BetterHelp or Talkspace, you've probably seen those ads. I know they're popping up on my podcasts I listen to all the time. They may or may not provide that same length of appointment. That doesn't mean the services provided aren't valuable, but that they don't necessarily meet that best practice time limit. How long someone needs to go to therapy depends on a few different things. In an ideal world, someone would get to go to therapy for as long as they wanted to, and as long as the therapist wanted to continue that relationship. I usually recommend leaning on your therapist recommendation on how often you should be seen, and balancing it with the other factors. And this is not really, Janae wanted to go more and her therapist wanted to pull back. In my mind, this is more like if your therapist wants you to come more often and you're like, oh, I don't know about that. You should trust them if they're saying they want to see you once a week versus maybe you only want to come once a month. But it is really important to take other factors into consideration. So depending on the acuteness of the issues, they may start at 1 to 2 times a week, sometimes even more. If it's less severe, they may want to see you once every other week or once a month. Where my therapist and I are now, it's kind of like on an as needed basis. So when I feel like I need to sit down and have a session, we schedule a time, and I try to do it at least like once a month. But other factors can absolutely complicate how often you're able to go to therapy. So if someone has insurance, it will depend on how many sessions are covered. Even though there's a law now that it's called mental health parity, where basically mental health is supposed to be treated equal to how physical health is, that isn't always the case. So some plans only cover a certain number of sessions in a time period. Others treat these like appointments to your primary care doctor. This is what my insurance plan is like. So the number of times I can go to therapy is unlimited, but I do have to pay a copay every time I go. Also affecting how often you will go will really depend on how much you can afford. Even for someone with a quote unquote manageable copay of $25, when you're going once a week or a few times a week, it really starts to add up. And these days when people are having to tighten their budgets, it may just not be feasible. And it can constitute a really significant financial hurdle. Finally, the last thing that really should affect how often someone can go to therapy is how often they can fit it into their schedule. For someone with competing responsibilities, let's say you've got a full-time job and you're also a parent, maybe you have volunteer stuff, and it just ends up, and at the end of the day, you don't have any time for yourself. It can be really difficult to simply find the time to go somewhere or sit down in front of your computer for that 45 minutes to an hour. But I will say this, if your only burden to getting therapy, if your only barrier to getting therapy is the fact that you can't find time for it, I really encourage you to make it a priority, because that's the thing about mental health. If you don't take care of it, it kind of has a way of sneaking up on you when you can least afford to take the time to take care of it. So take care of it while you can, rearrange your schedule so that hopefully it doesn't become a more pressing issue in the future. And we're going to go ahead and talk some about confidentiality, which is a really important part of the mental health treatment process. It's, in my mind, it is the most sacred and fundamental part of mental health treatment, because without it, or at least the promise of it, in my mind, probably fewer folks would access these important services. Confidentiality basically means that no one else should know you're receiving mental health services or know any of the details of treatment provided without your express written consent. Many providers, like when you first start therapy, will have you sign some documents that will give them the ability to share the information with your insurance company. And this is usually just for the purpose of reimbursement, and with others within their mental health practice. And that's usually for the purpose of consultation, or if maybe you have to be seen by someone else one week. Probably a lot of us on this call are familiar with HIPAA, which is the Health Insurance Portability and Accountability Act. This is the most basic guideline for confidentiality that's written into law, and it's not just for mental health treatment, it's for all health treatment. There are a few exceptions to HIPAA that I'd like to point out. that may not be protected, and that includes to prevent or lessen a serious and imminent threat, or if there's a court order. And lastly, children's mental health records, which I want to talk about just for a little bit longer. So children's mental health records are not explicitly protected under HIPAA from review by their parents. In Tennessee, under the age of 16, parents or legal guardians can request and receive records from the child's therapist or other mental health provider. Even though this isn't technically a HIPAA violation, it could absolutely go against a specific counselor's code of ethics. So if someone is worried about a breaching confidentiality, you can file a HIPAA complaint. And basically, if no wrongdoing is found, then I'd also encourage you to reach out to a counselor's accrediting body to have them do an investigation to see if that breach in confidentiality was ethical. I do recommend for all parents and caregivers on this call that even if you have a child in therapy and you want a copy of their records, that you really proceed with caution in getting those records. In my mind, it can be a serious breach of trust that can be difficult to recover from in a family relationship, especially if there is dysfunction in a family relationship. A child deserves to be treated with the same respect that their space is theirs to have and process what they need to. Related to this, it is really important to know in Tennessee that at the age of 16 and over, youth can be considered what's called a quote unquote mature minor. This permits healthcare providers to treat minors without parental consent, and the child has the same rights as an adult, including confidentiality. So confidentiality is the really fundamental foundation for therapy. So we're going to walk through what the therapy timeline looks like. And again, this is not all inclusive, and this will be really looking at it in an idealized way. In the real world, things can sometimes differ from this timeline. So in general, when you are making an appointment for mental health treatment, it's really important that we understand all the steps and processes behind it. Unfortunately, making a therapy appointment can be more difficult than making other appointments. So most therapists will require someone to make their own appointment. And usually that's by making a phone call, but it's more flexible now since the last couple of years. Sometimes you can send an email to make that appointment. Or if you're making an appointment online, sometimes there is a portal where you can go in. We've already discussed how to pick your therapist because fit is so important. So for folks with TennCare, you may not have the same ability to pick who you want to see specifically. You'll kind of just be assigned to whoever has an opening. But for private insurance, do that research ahead of time, see who'd be a good fit for your specific needs. I personally recommend having a list of 2 to 5 therapists you think would be a good fit, ranked in order of preference. Then you'll want to call to make the appointment. When you call before scheduling, verify a couple things first. First, is your therapist that's on your list, are they accepting new clients? If the answer is yes, then confirm they take your insurance, not just the insurance company, but also the plan type. So say I've got Blue Cross of Tennessee, and this is my plan type, make sure they take it. Once everything is good to go, it's yes to all those questions, you pick an appointment date. Then the next step will usually be the pre-appointment paperwork. This is going to be a multi-page document that outlines your personal information, what brings you to therapy, family history. And sometimes this is completed ahead of the appointment, sometimes it's completed during the appointment. It's not uncommon for someone to call and make their appointment and have to wait for months. When I most recently got back into therapy, I think I had to wait 3 or 4 months. That was by choice. I wanted to see someone specific. Usually, if you can be more flexible, you could get in sooner, but it's not uncommon for someone to have to wait for a while. So make sure to have a plan in place so you can make it to that appointment. And that can be support network, coping skills, stuff like that. So the first couple appointments, your therapist and you are really just getting to know each other, and they'll review your paperwork, get a good idea of what brings you in. And that's an important part of the relationship. It's a relationship that has to be built like other things. You don't meet your partner and suddenly you're becoming, well, maybe some people do, but most of the time, we don't get married tomorrow. So it's the same thing with your therapist. You may not be super thrilled about your therapist at first, but you have to give them time so the relationship can grow. Usually, after your first appointment, ideally, you would make an appointment for your next appointment. You would make that next appointment and you would keep going for as long as your therapist wants you to. Eventually, the goal is to reach a discharge and treatment end date, but again, that can be kind of an ongoing thing based on what you need. It's possible that someone never reaches the point where they're like, I want to stop going to therapy. And that is fine. There's nothing wrong with that. That's normal and healthy. I will say, in terms of discharge and treatment end, it should not end without warning on either end.
So I'm gonna kind of continue what Caitlin just hinted at about discharge, ending your treatment. So when do you stop going to therapy? Like Caitlin said, you might never stop going to therapy, and that is okay. And earlier we talked about how at first you might be going several times a week, to once a week, to bi-weekly, to monthly, to as needed. That timeline could, change throughout the course of your life. You might be in a place where you're going once a month, and next thing you know, you're going back multiple times a week because life happens. But let's say you are someone who wants to completely stop therapy. So when do you do that? How do you do that? What does that look like? So you want to stop when your goals have been met. I forgot to mention this earlier, but something else that you need to consider when you are pursuing therapy is, what are your goals? What are you hoping to get out of it? I would recommend taking some time to write out what you want to get out of your session. What do you want your therapist to help you with? Like when I went, I was like, well, I know I'm depressed. I know I have anxiety, and I know I have undiagnosed ADHD. So like, here's what I need help with. I was also in grad school, so I was struggling. I was like, I might not finish school if I don't get help. So I knew why I was going. So once your goals had been met, which I did finish grad school, but I'm still there. So that should tell you a lot. But if your goals are being met or have been met, then that is a safe place to stop. When you feel like you're no longer getting anything out of it. So if you leave your session feeling the same, feeling stagnant, feeling like nothing's really improved, but nothing's gotten better, you might be in a place where you're healthy enough to no longer be needing therapy. Or when you don't have much to talk about anymore, if your sessions are filled with lots of awkward silences, silences are good for processing, and sometimes you need a minute to process your thoughts. But if it's awkward because you don't know what else to say, or like they've said all that needed to be said, you might be in a place where you might be good to end therapy. And lastly, when you feel empowered to approach things based on your new insight. So once you feel like you got it, like you know what to do if your symptoms get bad, you know what to do if life happens, and you feel confident in yourself enough to handle life on your own, you might be in a place where you no longer need to go to therapy. I also want to say that you might feel like you're in a place to end your therapy journey, but sometimes it could also be maybe you need to see a new therapist. So let's say you're still having some of these problems, but you feel like you've maxed out on a therapist that you're with. It is okay to end that with them and pursue someone else. It doesn't have to be an end to your journey altogether. You might just need someone else to dissect and help you process some other things going on. Or you might be too comfortable with your therapist, and or you might be withholding from your therapist and you're like, well, maybe I should pursue someone else. So there are different reasons to stop your treatment or to discharge yourself, but these are some reasons to stop going. So some do's and don'ts. This is a very extensive list. I'll probably skip some of them. So just talk about what are signs that therapy is working and that your therapist is good and that y'all are a good fit, and some things that might scream red flag and that you should probably leave and find someone else. You want to make sure that you're able to trust your therapist. This doesn't happen overnight. Like Caitlin said, your first few sessions, you're getting to know your therapist, you're figuring them out, they're figuring you out. It's like dating in a very non-weird romantic way, but you're figuring this person out. You're wanting to get to know them. You're wanting to know if you can trust this person with your life. You're trusting this person with your mental health. That's not something to be taken lightly. Just like if you were to go to a doctor for your physical needs, you want to make sure that that doctor knows how to perform your surgery, perform your operation. You don't just want to assume that they're going to do it properly because they have a credential of some sort. You make sure that you feel safe. They encourage you to practice what you're learning from them at home. So I know for me, my therapist likes to give me like to-do lists sometimes because I'm very stubborn and I like to deflect. So next week, she'll be like, all right, next week, the first time I'm asking you is about this. And then I know that I needed to take that time out to practice what she gave me out of the session. So your therapist should want you to make sure that you're not just doing what you're supposed to do in the session, but that like you're taking this outside of that and that you're applying it to your life outside of what you're getting in your sessions. I mean, they need to be reliable. And that kind of goes into your scheduling. Like if they don't fit your schedule very well, or you don't fit theirs, you might need to pursue someone else. To make you feel good about yourself. Not in a toxic positivity type of way, because there are times where your therapist might have to tell you about yourself and tell you something that you don't want to hear. But in that, they're still making you feel good and acknowledging that, yes, this was hard, or yes, this was a hard conversation, but like you did it, or that like you made it through the session. So you make sure that you feel good in terms of you don't want to leave your session feeling more insecure about your identity and your character. But it's like okay to leave having some discomfort because you've talked about some hard things. There's a difference between the two. And they challenge you to think about things in new ways. That kind of goes into like your behaviors, your thoughts, and your feelings. How are you processing these things now that you're in your sessions? I think I kind of did go through that whole list, even though I said I wasn't, but that's okay. So signs that some things might be wrong. They share your information with other people. Kaylin just went into a whole thing about confidentiality. If your therapist breaks that in any capacity, then that is a hard no. That is a red flag. I'm pretty sure there's a process where you can like report them for breaching your confidentiality. But there are certain circumstances where they will have to report or tell someone. That's why when you are going through your intake process, you do put an emergency contact on there or someone that you're okay with sharing certain things with if certain things were to happen. So if you're self-harm, at risk for committing suicide, things like that, they will have to go outside of you to make sure that you can help that you need. They start hitting on you or start trying to pursue something romantic, or it gets very inappropriate sexually, things like that. Like you know when you're in a safe place with someone and when you're not. So if you're getting the vibe that they're trying to pursue something beyond a therapist to client relationship, that is a red flag. If they make you feel uncomfortable, not even uncomfortable in the sense of pursuing things that are inappropriate, but uncomfortable in the sense of like you don't feel comfortable telling certain things. Like if you don't want to tell your therapist about what you're experiencing, your traumatic experiences, then you probably shouldn't be there, because that kind of defeats the purpose of going to therapy if you don't feel comfortable enough telling them certain things. But like I said before, you have to gain that trust, and it does take time. When I first started going to therapy, I was not trying to tell her anything. I was very black and white. Here's what I need. Put me on some meds and send me back to school. And she kindly told me that's not how that works. And that's okay. They ask you out, like I said, anything that's dating related or romantic pushing is inappropriate. They invalidate your feelings. So like I mentioned before, like they should make you feel good about yourself despite where your mental health is at. So if they are invalidating your feelings, or if they're doing the opposite of what their job tells them they're supposed to do, then that is a red flag. If they cancel on you last minute, if they're not reliable, if not to say that life happens to our therapists too, life happens to everyone, they might need to cancel, but if they are consistently canceling their appointments with you, then that is a red flag. Or if they are just not able to fit into your schedule, even if it's not intentional that they're not able to make your appointment, then you might need to find someone else. They talk about your body image, they yell at you, they minimize your problems, or they encourage you to kill yourself. That is the reason to leave. And like I said before, I'm pretty sure there's a reporting process if any of these things are happening to you in your sessions.
So we have limited time, so I'm gonna kind of try to get through these real quick. So therapy is one of those things, you get out what you put in. So it's important to communicate and be open and honest with your provider if you are not getting out of the sessions what you want to. If they're a good therapist, they will take you at your word and not be offended, even if they're privately hurting a little bit, because they want you to be honest with them. And you need to practice what you learn in therapy home. So that homework Janae was talking about, you really need to put it in practice outside of your sessions. We're going to talk hopefully quickly a little bit about medication. If you want to move forward one slide, go ahead and move forward. So mental health is a really common part of folks' mental health journey. These are the most common mental health meds. Just because they're called antidepressants, anti-anxiety, antipsychotics, does not mean that they're only used for depression or anxiety or psychosis. Though there is a gender difference, most commonly older adults and women more commonly used psychiatric meds. So here's some basic medication info. I'm not a physician, so if you are interested in learning more, definitely reach out to your doctor. Medications, really mental health treatment, they're not cures. It's treatment. So medications can be used short or long term. It's can be difficult sometimes to figure out what is going to be right for you. So doctors may try one medication for a certain dose, or they may up the dose if that doesn't work, or switch to a different medication or combination of medications. And that can be a very frustrating figuring out what works for you. It can take time to feel better. In the meantime, sometimes folks have really uncomfortable side effects that they're pushing through until that point that they feel better. Depending on the medication, it can take anywhere from a month to a couple months. And it is important with any of these meds that you avoid taking anything that your doctor is not aware of, so you can avoid potential unintended side effects. It's important to take medications at the same time, set reminders, and communicate with your doctor on side effects.
I didn't realize that we only had like 5 minutes, so I'm not going to go into detail about all the types of medications. But some of the most common ones are antidepressants and anti-anxiety. A lot of the times, antidepressants are also used to help with anxiety as well. So like Kayla was saying, one medication could help with multiple things. So like the medication that I'm on is for my anxiety and my depression, not just either or. And then we have stimulants, which are mostly used to treat ADHD. And we know Adderall is a very common one. Then we have antipsychotics, which is to help manage psychosis. But those can also help with depression when paired with other antidepressants, and it's also used for bipolar disorder. So like I said before, all of these can kind of, depending on what you're struggling with, they can help with one or more of your mental illnesses, and it's not a one size fits all. You might have to try a variety of medications before you figure out what works for you, and that's okay. And then we also have mood stabilizers, which is to help with bipolar mania and hypermania, and with severe / recurrent depression, and it helps to even out your mood swings. You guys will get these slides, so you can read all of that stuff. But also never stop taking your medications without talking to your doctor first. You never want to go on a hard quit. You never just want to stop one day. You never want to do that. And that's why Caitlin mentioned you want to make sure that your prescriptions are getting refilled with a little bit of an overlap is okay. Like I think mine probably gets refilled a week before I'm actually out, just so that you don't have an awkward gap between your prescriptions, because that can hurt your mental health a little bit in those days, in those gaps. And you also want to make sure that your therapist is aware that you want to stop your medication so that they can be aware of what's happening when you do that. Some side effects, not reading all of them because time, but kind of the same side effects that you can expect with a lot of other meds are pretty common with medications for your mental health as well. So headache, upset stomach, anxiety. Sometimes your mental illnesses can worsen with your medication, so you want to be careful about that too. So I was on a set of meds that made my symptoms a lot worse than they were before I was on my meds, so I had to change them. So you want to be really aware and be noting what's happening as you're taking your medications, and pay attention to some of these symptoms, and make sure that you're reporting it to your therapist, what you're experiencing, so that they can help you.
So, because we're running short on time, as long as you're in agreement with me, Jeanne, I was thinking we might be able to just skip ahead to some resources. So we won't have time to talk about inpatient and hospitalization and crisis services and how that works today, but there are some resources that Jeanne will touch on real quick, and then we'll finish off with a little time for questions.
Yeah, so 988 is the new, it's new, right? It hasn't been that long, but
July.
July, right? The same concept is what you would use 911 for. So if you're having a mental health crisis, or you need an intervention, you call 988 and they will address your situation accordingly. We have mobile crisis, which I'm not super familiar with, but I don't know. Caitlin, do you know? You put that there. You talk about
Yeah,
it.
so mobile crisis is a 24/7 team handled by different providers across the state. So here in East Tennessee, we have McNabb for youth villages, in addition to a few other providers. They're trained clinicians who are able to provide assessments and intervention when needed.
Yes. And then we have 911. Depending on where you live, your police officers might have some level of mental health intervention training. Most don't still, but I know a lot of places are trying to work that into their training processes so that they know what to do when they approach a scene and it is a mental health crisis and not a crime.
And just quickly, mobile crisis likely won't respond if there is a medical concern or a safety concern. So that's usually when 911 becomes the preferred form of intervention. So I know we had to speed through that, but mental health treatment can be incredible. But like other forms of healthcare, it's really important to advocate for yourself and be involved in the process. And recognize that you do get out of what you put in, and it's important to actively work toward your recovery, but don't accept anything less than, like, if you are receiving services in an unethical way, something that makes you uncomfortable, you don't just keep pushing forward with something that's not going to be a good fit. In my mind, if bad mental health treatment can be worse than no mental health treatment at all. So do what you need to do to make sure you're getting the best form of treatment for yourself. We'll put up some contact information. We definitely would love you all to take the survey. And for those of you that can stay on a little bit longer and have any questions, we would love for you to put them in the Q&A. If there were any in the chat that came up, we'd be happy to answer those now. And thank you to everyone who attended.
Yes, thank you both for the great presentation. And I don't see any questions, a lot of thank yous, and great information and resources. You all did a great job. I think we could have spent quite a bit
2-3
more time.
hours easy.
Yeah. It never seems like it's enough time. So, but thank you all so much for joining us, Caitlin, Janae, thank you so much. And we hope that everyone will join us next Tuesday as we wrap up our last of 4 series. And that is improving workplace culture and mental health. I know Casey has provided the link also in the chat for the evaluation. We encourage you to do that. And also a link for next week's, if you haven't registered already, but to register for next week's Lunch and Learn. So thank you all and have a great rest of your week.